To this date, the Department of Defense and the Department of Veteran Affairs have gone separate ways. We each have separate systems and each are supporting separate electronic systems. And while we've been able to advance interoperability at the cost of hundreds of millions of dollars to the taxpayers, today we still have separate systems that do not allow for the seamless transfer of information. We're able to read each other's records right now. That's called interoperability, or at least that's our certification. But what you're not able to do is actually work together to plan a treatment, to be able to go back and forth between the Department of Defense and VA. And so we've not been able to obtain that to this point. And so for those reasons, I decided that VA will adopt the same electronic health record as the Department of Defense. So we will now have a single system. That system is known as the MHS Genesis system, which at its core is Cerner Millennium. The adoption of the same system between VA and DoD is going to allow all patient data to reside in a common system. To a veteran, they're now going to be able to have a single system from the time that they enlist in the military until potentially they die, one single lifetime record. And so there will never be a need to be able to go back and forth and say, records aren't there for me, or my doctor isn't able to have input into what the Department of Defense is doing, and our community partners need that same type of interoperability. The Department of Defense and the Department of Veteran Affairs are together in lockstep on this, and the President is behind this, and we need Congress to support it, and I believe that support will be there.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.